Good afternoon, everyone. My name is Tianmei, and I'm here representing the Bridgeport Department of Health and Social Services. Today, I will be discussing a critical issue that affects our community, particularly our children, which is childhood lead poisoning. We'll explore what lead poisoning is, where lead exposure comes from, how it affects children's health, and most importantly, how we can prevent it. Here's what we will cover in today's presentation. We will begin by discussing the pathology of lead poisoning, followed by prevention strategies, treatment options, and the importance of long-term monitoring for affected children population. Let's start with the pathology of lead poisoning. Lead is a toxic metal that can cause a range of health problems, particularly in young children. It primarily affects nerve systems and can lead to developmental delays, learning difficulties, and other serious health issues. Unfortunately, children population are more susceptible to lead poisoning because their bodies absorb lead more easily than adults. Even low levels of lead exposure can have harmful effects on them. Lead can be found in various environmental sources. One of the most common sources is lead-based paint, which was used in homes built before 1978. As this paint ages, it can chip and create lead dust, which is easily ingested or inhaled by children. Lead can also be present in soil, especially around older homes where lead paint may have fallen. And lastly, in water, if plumbing fixtures or pipes contain lead. In addition to environmental sources, lead can also be found in non-environmental sources. These include imported foods, spices, and even some types of jewelry and cosmetics. Certain occupations and hobbies, such as housing remodeling or working with stained glass, can also expose individuals to lead, which can then be brought into home and pose a risk to children. There are several key questions to consider when assessing the risk of lead poisoning in children. Does your child live in or often visit a building built before 1960? Does your children live in or often visit a building built before 1978 that is being or was just repaired or remodeled? Does your children live in or often visit a building that has peeling or chipping paint? Does your child live with an adult or often visit an adult whose job or hobby exposed them to lead? Does your family eat or drink from dishes made outside the US? Does your family use home remedies? If you answer yes to any of these questions, you may want to have your child tested, even if your child is older. This is because lead exposure can have severe consequences for children's health. Without letting your child look sick, it can slow down the growth and development, lead to learning and behavioral problems, and cause damage to the brain and nerve system. This can result in a lower IQ, decreased ability to pay attention, and poor performance in school. It is crucial to understand this risk and take action to protect our children. Now let's talk about prevention, which is the most effective way to combat lead poisoning. Preventing exposure to lead is essential to safeguarding our children's health. To reduce the risk of lead exposure in children, it is important to take several key steps. For example, replace old wood paint, especially in homes built before 1978. Clean up lead dust and paint chips regularly with a wet mop. Keep vulnerable populations away from all lead exposure and establish a lead-safe environment by removing shoes before entering the home and washing children's hands and toys frequently. Last but not least, ensure your child is tested for lead, particularly at ages 1 and 2. Although it is not mandatory in Bridgeport, it is still highly encouraged. Adults who work in environments that are possibly exposed to lead should also take specific precautions to prevent bringing lead dust into home. These include not eating, drinking, or smoking in working areas, washing hands and face before eating or drinking, wearing protective clothing, and showering and changing clothes before leaving work. It is also important to wash work clothes separately from family laundry to prevent contamination. Testing is a critical component in detecting lead exposure and also an effective prevention strategy, because you can know if your child is at risk by getting tested. All children should be tested for lead poisoning at about ages 1 and 2. If a child is at risk of exposure at other ages, testing should be done at those times as well. Blood tests can indicate how much lead is in a child's blood and guide the next steps for treatment if necessary. If a child is exposed to lead, there are treatment options available depending on the level of exposure. For low-level poisoning, which means when your child gets tested and the lead level in blood is around 5 to 10, a dietary change can help reduce lead absorption. Food rich in calcium, zinc, and iron can be particularly beneficial. And we have some food suggestions on the graph shown here. Furthermore, stop exposing your children to lead hazard is also a way of treatment. Lastly, getting your child tested in a timely manner to track if there is a drop of the lead level in body. For high-level poisoning, medical treatments such as chelation therapy may be necessary to remove lead from the body. Long-term monitoring is essential for children who have been exposed to lead. To prevent lead dust inside your home, take steps such as moving furniture to block access to chipping paint, covering windowsills with contact paper, and keeping windows closed that have peeling paint. It is also important to inform babysitters and other caregivers about lead hazard in your home to ensure consistent protection of your children. Additional methods to prevent lead dust, including placing doormats both inside and outside the entrance to your home, and removing shoes before entering, can help prevent to track lead-contaminated soil inside. And it's also important to keep your pets out of bare soil areas where they could be exposed to lead. If you need more information or assistance, please don't hesitate to reach out to us. Bridgeport Department of Health and Social Services and Connecticut Department of Public Health are here to support you with resources and guidance. Our contact information is provided on this slide, and you can visit our official state website to access electronic brochures and educational materials. In conclusion, I want to thank you all for your attention and commitment to protecting our community's children from the dangers of lead poisoning. Together, we can create a safer environment for our families and ensure the health and well-being of the next generation.